Carrie. I'm going to show you how to do a couple shoulder x-rays. I'm going to start off with the AP shoulder projection with internal rotation. I'm going to use a technique of 85 kVp at 10 mass, and I selected my upright Bucky on the console. I'm going to use a 10 by 12 cassette. I already put it in with the green stripe towards the patient's right side, and I'm at an SID of 40 inches. So now that my room is prepared and I have a shield nearby, I'm going to grab my patient. Okay, so I have my patient, Miss White. Can you tell me your first and last name?
Betty White,
And your date of birth?
5/22/85.
Okay, and any possibility you could be pregnant? Okay, I'm also going to have her change into a gown and take off any bra strap that may be in view or necklace or anything like that. Can you tell me what happened? What brings you in?
I was riding my bike a week ago, and I fell, and I think I landed on my left side.
Okay.
So and then it hurt.
So your left shoulder hurts?
Yeah.
Okay. All right. So what I'm going to do is put a shield around her. And then perfect. So then go ahead and face the camera. I'm going to put your back towards the board. And just move over to your right. And right. A little bit more. There you go. Right about there. So I'm going to have her bend her elbow just a little bit and place the back of her hand on her hip. And then I'm going to center my central ray 1 inch inferior to the coracoid process. I can do that by palpating where her clavicle is and going below that and medial to the humeral head. And then I'm also going to make sure that the epicondyles are perpendicular to the IR. I'm going to collimate in a little bit. Make sure I have the whole shoulder in there, and place my left marker in the light field. And then I'm going to have Miss White hold her breath and then take my x-ray. Okay, so now I'm going to do the AP external rotation. I am still at an SIG of 40 inches. I still have my technique at 85 kVp at 10 mass with my upright Bucky selected. I also still have her shielded. I'm using my 10 by 12 IR crosswise as well with the green stripe towards her right side. And I'm going to abduct her arm slightly and rotate it externally. So I may place the epicondyles parallel to the IR, so the hand will be supinated. Are you in any pain? Are you doing okay?
No,
Okay. And then I'm going to have my central ray again, 1 inch inferior to the coracoid process, which I can palpate by feeling below the clavicle and medial to the humeral head. And then I'm just going to have, and I also have my marker still in the light field. So then I'm going to have Miss White hold her breath and then x-ray. Okay, so now I am going to do the PA oblique projection on the scapular Y. It's going to be in LAO position, so her anterior surface is going to be close to the Bucky, and the central ray will be entering posteriorly to anteriorly. I'm doing the technique of 85 kVp at 18 mass. I'm still using my upright Bucky, and also doing an SID of 40 inches. I have my 10 by 12 IR now in portrait, so the green stripes at the top, and put in my Bucky. So now this way I'm going to have you face the Bucky, face the wall here. I have my marker here still, and I'm going to line her up so she is rotated 45 to 60 degrees. away or to the IR. I'm gonna palpate for her scapula surface to make sure that it is perpendicular to the IR. I'm also gonna feel for the superior angle of the scapula and for the acromial tip to make sure that that is also perpendicular to the IR. And then have the CR and IR enter to the scapulohumeral joint. And then I'm going to also make sure that she is shielded and place my marker in the light field. And then I'm going to have Miss White go ahead and hold her breath and then x-ray. Okay, so now I'm going to do a superior inferior axial projection of her left shoulder. I have an 8x10 placed at the end of the table lengthwise with the long axis. I'm doing a 75 kVp at 5 mass with the tabletop selected. And I also have a SID of 40 inches and Miss White is still shielded. So what I'm going to have her do is lean laterally over the table and put her arm over the IR with her elbow rested on the table and her hand prone. I'm going to make sure that the shoulder joint is over the midpoint of the IR and have her head tilted away from towards the unaffected side. I'm also going to make sure that there's no anterior, posterior leaning, so I can put the humeral epicondyles in a vertical position. And then I have my CR tilted 5 to 10 degrees through the humeral or through the shoulder joint and towards the elbow. And then I'm just going to collimate in. Positioning a little bit. And then I'm going to make sure I have my left marker in the light field. And so then I'm just going to have Miss White hold her breath and x-ray. Okay, so I just finished with my shoulder x-rays. So now I'm going to select my patient and the correct positions that I did and scan my plate, put it into the reader for each one, and then make sure I have everything and they look okay, and then fax them and send them and QC them to the doctor.
So this is the criteria for the shoulder AP in internal rotation. There's proper collimation. We can see the superior scapula and the clavicle and soft tissue. The lesser tubercle is in profile and pointing medially. There's the outline of the greater tubercle superimposing the humeral head. And there's a greater amount of the humeral head overlapping the glenoid cavity in this position. So this is the criteria for the AP shoulder in external rotation. There's proper collimation. You can see the superior border of the scapula and clavicle, as well as soft tissue. The humeral head is in profile, and the greater tubercle is on profile and on the lateral aspect of the humerus. The scapulohumeral joint is visualized with a little overlap of the humeral head on the glenoid cavity. And there's the outline of the lesser tubercle between the humeral head and the greater tubercle. So this is the criteria for the superior inferior axial projection of the shoulder joint. There's proper collimation, and we can see soft tissue in the axillary area. We can see the scapulohumeral joint The coracoid process is above the clavicle right here. And the lesser tubercle is in profile. And we can also see the AC joint through the humeral head. So this is the criteria for the shoulder joint, the PA oblique projection, scapular Y. This is a RAO. There's evidence of proper collimation, and we see the soft tissue. We can see the humeral head and the glenoid cavity superimposed. The humeral shaft and scapular body are also superimposed. There's no superimposition of the scapular body over the bony thorax. The acromion is projected laterally and free of superimposition. The coracoid process is projected below the clavicle, and the scapula is in a lateral profile with the lateral and vertebral borders superimposed.